It was like God hit a gong symbol and it was just reverberating in my head. Through a day of prayer, I'm hearing God call me, become a dentist and reverse the negative stereotype of dentistry. Everything we touch and change alters the energetics of that individual. Appreciating that is the start to really being able to not just drill and fill, but to actually change lives.
We know that dental health is linked to up to 57 chronic diseases.
In healthcare, the system that we have come to accept doesn't allow significant enough time for listening. Every word that the patient uses has meaning. When somebody says, I feel like, you write down everything that they tell you, because that energy they're sharing is the secret weapon to understanding what's going on for that human being. We're 100% focused and intentionally giving our time to one person at a time. And I don't go do the next thing until we're done with that. And it really changes the experience for people. I mean, the healing I've witnessed, it could be described as miraculous.
Thanks for tuning in to Becoming Superhuman. Today, I get to share with you my conversation with Dr. Kelly Blodgett, who is the founder of Blodgett Dental Care in Portland, Oregon. And he truly has one of the most pioneering, most cutting-edge dental practices I have ever heard of in the nearly 15 years I've been doing this. And in this conversation, we discuss Kelly's divine calling into dentistry and his purpose to reframe and reshape the paradigms that have bound dentistry into a relatively archaic way of practicing healthcare up until now. He also discusses how listening to his patients and really hearing what they're telling him is one of the greatest skills that he thinks he's developed as a practitioner over time. And we also discuss some of the really cool aspects that he has integrated into his practice, like naturopathic medicine, functional nutrition, and electroacupuncture to provide the best possible, most holistic, whole health care experience he can for his patients. I am sure you are going to have an awesome time listening to this because it was so interesting to have this conversation with him. Welcome back to the Becoming Superhuman podcast. I am so excited for today's guest. Today, we have Dr. Kelly Blodgett, who is a board-certified naturopathic dentist, as well as an integrative biological dentist, blending science and soul in ways that honor the whole health of the body. At just 21 years old, while studying psychology at the University of Oregon, he felt a divine calling from God to reverse the negative stereotype of dentistry. And through his one-of-a-kind clinic, Blodgett Dental Care in Portland, Oregon, he has helped shift the narrative on what dentistry can be. His approach centers on the person and not just the procedure, and after years of transforming the lives of patients and educating other healthcare professionals, Dr. Blodgett's social media series Toxic Tuesday and Wellness Wednesday inform all of us of the importance of an intentional approach to dental care. I'm so excited to have you here and to have this conversation with you.
Thank you, Nirvani. Wow, that was, I love that intro. Thank you. That was beautiful.
You're welcome. Yeah, you're very welcome. Well, it's you made it easy because you've been up to a lot, and truly, as far as dentistry goes and professionals within the industry, what you're doing and the information that you're putting out, it is really exciting to see because you are talking about and you're highlighting things that just don't get acknowledged a lot of the time within dentistry. And so I think we're due for a paradigm shift, and you're very much leading the way in that. So thank you for all of the work that you have done and you're continuing to do.
Well, thank you. It is truly my pleasure. It's such a unique experience at this point in my career that, you know, I've been out doing dentistry for 26 years, and I've spent the last 3 weekends in different parts of the country, coaching other healthcare providers and their teams. And it's helpful for me to see through the lens of more of a traditional practice who has become inspired to develop into something kind of like what we've created with Blodgett Dental Care. And it's nice to be able to help these folks avoid or minimize, maybe shorten some of the speed bumps that you're going to go over as you start looking at, well, things like when you're integrated with insurance programs and stuff, is that designed to best care for your patients? Does it help them achieve their goals? Things like that. So anyway, I'm excited for us to have a conversation and share, what I've experienced as we have embarked on this path of really removing restrictions for people to have optimal access to care.
Wow. Yeah. I can't wait to get into a little bit more of the behind the scenes and how things actually work in your clinic. Before we do that, I just wanted to touch on something that I had just brought up in the introduction that I thought was so inspiring and beautiful when I heard and then I read it as part of your bio. But you talk about being divinely inspired by God to pursue dentistry and to pursue a career and to sort of change how the profession and the industry are perceived. And God, divine, these are words that most healthcare professionals we don't hear from. And most people don't openly discuss these things. And for me, I think that really that connection to divine power and a connection to God and being led by something that's greater than just yourself, it really does give everything we do in life, including our careers, a different level and a deeper level of meaning. And so having said that, could you just talk a little bit about how your connection to God and how your faith has shaped how you practice?
Yeah, I would love to, and thank you for the opportunity. So to give some of the context and the background, when I was in high school, at that point in my life, I had essentially zero faith life, or really I had a desire not to acknowledge a power greater than myself. And through that lens, I felt inspired by psychology and human communication. My mom was always big on how you use words, and I guess the idea of how people think and their narratives that they tell themselves, that just inspired me. So that's what I decided to pursue when I went to college. And in my mind, with my own Kelly created vision, it looked like I saw myself sitting on the comfy chair and talking with people about, helping them to see their own possibilities through psychology. So I pursued a master's in psychology, got into a program, and it was about 2 months before I was graduating from college. And I had been dating this gal for about a year and a half, to whom I've been married now for almost 31 years. And she had a really good relationship with Jesus. And I was like, that sounds like craziness. You're brainwashed and all that. And then through a series of events, which would take more time to share than we have, but God opened a door for me to come accept Christ as my Savior. And the next thing you know, I'm practicing a prayer life and releasing my will to God and praying that He'll guide me in the path where He wants me to go. And like 2 weeks after that, I'm having margaritas with my wife and my sister-in-law, and I have an identical twin brother who had always wanted to be a dentist. So I was peppering her with questions about what's he doing and how's he getting into school and blah, blah, blah. And apparently I sounded highly interested. And my sister-in-law she says, why are you so concerned about Chris? Like, why don't you pursue dental school? And it was like God hit a gong symbol and it was just reverberating in my head. And the next thing you know, through a day of prayer, I'm hearing God call me, become a dentist and reverse the negative stereotype of dentistry. So I was 21 years old, had no interest at all in dentistry. And thankfully, my father-in-law was a practicing dentist at the time. And
Okay.
I called him up, this is back before cell phones, of course, and said, hey, could I take a bus over to where you practice? He was about 3 hours away and come and just hang out with you for a couple of days and see what you do. And it became so obvious to me once I spent, like within the first 2 hours in his office, I watched him not just doing the dentistry. I mean, that was all cool that he could make smiles and, gently remove teeth and stuff like that. Excuse me. But it was how he interacted with people, how he helped them feel comfortable. And I was like, wow, like I see all the time I had spent taking, every psychology course that the University of Oregon had to offer. It became clear to me that I like working with my hands. I like fixing things, but I love sitting with one-on-one with another human being to hear their story. Now, how that then would be applied in the practice of dentistry was something that was totally unclear to me. It's something about which I continue to pray that I'm guided to have the next door open, whatever that means. I mean, that has looked like, continuing education opportunities. That has looked like patients walking in and asking me, hey, doc, have you ever heard of this? It has been through patients, for instance, ceramic implants. I'd never heard of them. And like back in 2010, one of my high school classmates was seeing me for some care. And he says, hey, Kelly, have you ever heard of ceramic implants? Because we were about ready to do some implants for him. I'm like, what are you talking about? And so the next thing you know, that opens up this Google rabbit trail that, I'm going down to find out what is this stuff. A patient handed me Tom Levy's book, Curing the Incurable, like 10 years ago. I'm like, well, I imagine if this person felt inspired to bring me a book, there's probably a reason I should read it. And what that has created now, 2.5 decades later, has become a space where we have completely reinvented how we enroll people in the experience of dental care. Primarily, that looks like us having given up our Mondays that used to be a clinical day. You'd come in, fix teeth, go home, We decided 5 years ago, it was the week before COVID shut us down, actually, that we were going to stop doing patient care on Mondays and pre-block out 2-hour time slots for a specific number of people who wanted to experience the highest level of human connection in dentistry. And it really struck me, if you don't mind me sharing a story, on
No, not at all.
On Wednesday, it was a long clinical day where I had blocked out I was only seeing 2 patients. It was a mother and a daughter. They were flying up from Houston, Texas to Portland, Oregon for me to help them. And the daughter was going first and she was very nervous. She's relaxing kind of in our green room. It's like the pre-surgery. It's a really comfortable room, very spa-like. But, my assistant said, Dr. Blodgett, she'd really like to have a conversation. And I'm like, absolutely. So the anesthesiologist and I went and sat with her and we just talked, and addressed, like, she's like, I'm so anxious. And I'm like, well, tell me more, tell me what is it that feels anxious? And we created and allowed space for her to express her humanity, which is, this is a big deal. I've got a family, I've got kids. It's like, I'm going to sleep for this. And the whole point of me sharing it is at the end, when she finally, I could see her energy become centered. She looked at me and she said, thank you so much for listening. And that just struck me as like powerful, that in healthcare, the system that we have come to accept by and large doesn't allow significant enough time for listening. And we choose to most providers choose to participate in it. And I looked at it and I said, well, you're welcome. I'm so, like you're the person I'm seeing today, but my whole day is for you. So, we can take as much time as you like to express how you feel, and I want to acknowledge it. And then, of course, yesterday when I saw them for their post-surgery and post-restorative visits, within 24 hours, the stories of, for instance, her mom who couldn't walk, like her mom couldn't walk for more than a minute, that day went out and walked the mall with, her daughter and her family who had come to support her for 3 hours. And the family's just blown away. Like, what is this that you're doing?
Yeah.
I'm like, well, yes, it's the clinical care. That's a part of it, certainly. But it's also that we're 100% focused and intentionally giving our time to one person at a time. And I don't go do the next thing until we're done with that, And it really changes the experience for people. I mean, the healing I've witnessed, it could be described as miraculous. I mean, I understand it as the energetic side of it and the physiologic side of it and all that. But, and we're still learning, by the way. I'm probably like you, doing a lot of continuing education to see what's the next path where I can help people better.
And I would love to get into a little bit about how how your current state of practice sort of unfolded over the years, because I know, like me, you went to a North American conventional dental school, and you probably learned all of the things that every other dentist who's practicing here learns. And when you get into practice, oftentimes it doesn't look anything like what you just described, meaning you're pressured to see lots of patients, you're running around, your schedule is jam-packed with lots of people in multiple chairs, and that time and that intentionality that you're describing and that you have actively cultivated for your patients and their experience with you, you don't necessarily get that in most offices.
No.
And most dentists don't even have that as a framework for how they should or could practice.
Yeah.
So what did your path from learning all the things that every other dentist learns to where you are now, how did that sort of unfold, and what steps did you take to learn the things that you know?
Great. So one of the things that I think was massively impactful for me as I was wrapping up dental school, which, by the way, I thoroughly enjoyed dental school. I come from a family where I was taught to work, and I had 3 different jobs all the way through dental school. I mean, I kept working, and
wow.
so I always had this perspective. I remember one day I was one of my jobs in dental school was working at the Oregon Zoo doing janitorial for all the summer concert series. And I got asked to go pick up some rhino crap that had been dropped on the walkway. And as I'm scooping up this crap, I'm thinking, you know what? Like, I'm so grateful to be in dental school.
Yeah.
I know I won't be, shoveling shit forever, Oh, man. So I always keep those perspectives in mind. But anyway, one of the things I recall, so my father-in-law, when he was coming out of dental school, he came to Portland from Ohio because he wanted to do a general practice residency in a hospital. And he had always encouraged me to do that. And of course, I'm looking at it from the perspective of like, well, gee, one more year of making no money, really, after all these years of school? But what I did was I started asking students who had gone on to residency and those who had not, hey, tell me about your experience. What's it like in a hospital? I was asking my friends who'd gone out into private practice, and the common theme I kept hearing was, Oh man, I learned so much in the residency. I'm so grateful for it. I'm so glad I did it. And all of the students that I talked to who went out into private practice were shell shocked. They're like, "Oh my gosh,
Yeah.
I feel like I don't know anything." And so I went straight out of school to the Portland VA hospital and spent a year there, where I got to see healthcare really being provided in a whole sense. I mean, even though we were still doing root canals and a lot of metal-based, it's fine. What I remember most was patients who were in hospital beds. They were so sick, they were in hospital beds. And they're getting prepared to go into the OR to have whatever done. Maybe it's a tongue resection due to cancer or something like that. And they'd wheel them in the hospital bed into our dental clinic, into the rooms where we had space for that. And we would do examinations, because the following day I would then go to surgery with them and manage the dental aspects of their health. So I got to view this healthcare practice as a whole, or considering the entire body, from day one out of dental school, which, I mean, heck, if they'd have given me 2 or 3 years to do it, I would have done it. It was some of the most fun I've had in my career, and certainly, like, talk about learning fast, It was,
Yeah.
deep. So
Yeah.
so I do that. I come out of school and I go into an associateship, where the intention had been for me to become a partner in the practice. It didn't work out that way, but what I got to witness in those 9 months at that practice, and all good people, by the way, great dentists, great hygienists, the whole staff, wonderful people. I got to see through the lens of how communication and words are used in what I would consider a highly inappropriate power dynamic. And what I mean by that is the language that we hear used in healthcare. And by the way, I'm writing a book on this that'll come out in September, called Feel Whole Again. It's about the feelings that people have and the words that we as professionals use to, in essence, erase the subjective sides of healthcare so that our objective agenda becomes the priority. Things like, you need this, you should do that. And so I was sitting here listening to this all around me at this associateship, and it was like fingernails on the chalkboard. And so I determined, when I become a practice owner, whatever that looks like, I want to embody words that are honoring of the other human being's feelings and thoughts. So that was very impactful. And then, so I ended up buying my own practice. And the insurance change for me happened very early on. So, I buy my practice in 2001. I intentionally chose not to change anything for a year. I'm like, let's just make sure that we can keep the ship sailing straight, that I can make a living and support my family, because, they don't teach MBA programs in dental school.
That's right.
Right?
Yeah.
So I was at the Oregon Dental meeting, April of 2002, and I start talking with a couple of dental laser companies. And long story short, I end up choosing to buy 2 dental lasers. And I recall probably the next month, we billed for a procedure for which we had used the laser to help us provide a better level of care, truly. And I remember it was a Delta Dental, it was the Oregon Dental Services. They sent us back this letter that says, Dr. Blodgett, we received your claim. However, because of your, the fine print in your relational agreement with us, you don't get to charge for these things. You've agreed to that. And I'm like, why would I intentionally limit myself from providing better care for my patients? And so, I did the work to determine how many people in my practice currently have that insurance, and to what level would I need to increase my fees if I got rid of the insurance, so that I could make sure to keep affording to run a business that, whose focus was to offer better care. So I dropped all insurances in 2002. And I just decided, I'd much rather struggle doing what's right for people and not being limited by insurance companies who never have looked in their mouths to begin with. I wasn't going to be constrained by that. So I would say, like when I give talks to dentists about how I got here, it was recognizing first the psychology, and then 2, engaging with the technology So for the first 15 years of my practice, that was really the focus. Lasers, CEREC technology, doing regenerative laser-based procedures, stuff like that, getting 3D cone beam technology back in 2008, all that techno stuff, right? So I did that and I was thinking like, this is pretty cool, but it didn't feel whole. I felt like there was something else. And that was about the time when patients were asking me way more questions about biologically based things about which I had no understanding. So I remember picking up a book about it 10 years ago called Whole Body Dentistry by Mark Briner. And as soon as I read that, I was like, that's the third leg to the stool. It was the psychology, the technology, and the biology was the one missing piece to this puzzle. And as we started engaging in more biologically based things, I mean, we already had people traveling because of the technological stuff we were doing, but that opened an international door for us that I really didn't expect. And then once I started sharing the stories of health rejuvenation we were witnessing on Instagram, which quite honestly, I was so opposed to doing, I was like, my life's busy enough. And my team kept saying, Dr. Blodgett, you've got to share these stories. It's unbelievable. People like regaining their eyesight, being able to walk again when they couldn't. And I'm like, I couldn't deny that it would be worthwhile to share that. And so that was the path of the practice core. But what we ran into 5 years ago was, okay, we've got people traveling from all over the place for our help, but they're just being placed everywhere in the schedule. It's like there was no intentionality to us creating real time and space so that they could share their story and their goals and their values and their timelines and budgets and all this stuff with unconstrained time built around it, I mean, yes, there's kind of a 2-hour block, but clearly sometimes that goes a little longer. And that was the day when we decided to change it all. It was March 12th of 2020. I'll never forget the day. I also will never forget coming back on the 17th, which was a Monday, and hearing from the state of Oregon that you have to shut your practice down. And, but I have to say, there's blessings in all things. And had COVID not occurred and us being shut down, we never would have thought to completely erase our schedule, which we had to do because we had to reschedule everybody. It gave us an opportunity to go back, build it from scratch, the way that we've designed it. We all agreed we're going to give it 1 year and see how it goes. Because the one of the concerns, of course, is like, well, if as a practice we're going backwards financially, then I don't have the resources to continue growing this thing to better serve people.
Absolutely.
And truly, I mean, God just blessed us beyond during COVID, we grew, taking 2 months off, mind you, on the entire year, we grew 30%. And I was like,
wow.
Oh, okay. Maybe this is possible. And gosh, I guess it was 2 weeks ago, I was in Kansas City with a practice. The weekend before that, I was in Scottsdale, Arizona with a practice, helping them see what's possible. And for them, they're, individual practices, we're helping them go to where their goals align. But understanding that with the help of their team, you cannot do it without your team. You guys can do anything, which is so resonant with what you're doing. Becoming superhuman means stop thinking like a human. Think about endless, limitless possibilities that the universe has to offer us if we allow that energy to flow. And, we've had to divorce ourselves from what we were taught back in school is that this is the way we all do it. We're like, well, what if we did it a different way? Which means, on your team, you might want to think about having some people who weren't trained in such a linear fashion and who have high wonder brains. Because those will be the team members who say, well, hey, what if, literally our new patient Monday was the brainchild of 2 of my team members. And I was like, well, we know what we're doing right now isn't working. So why don't we try it? So I know that was a little bit of time for me to share it all, but that's the path. And I guess one of the key spices to the soup in this thing is my faith in God, that by doing something new, trying something new, He'll either show me it's right or it's not. And my job is to do the work and to be faithful. And it has, as I shared, I mean, it has worked out beyond my wildest dreams. I might be going a little bit, too much energy perhaps, but
No, that's amazing. That's what this is for.
Yeah, I think like next weekend will be the first weekend I've been home in like 3 months, but there's so much to go out and share, and also so much to learn. I mean, there are still, tens of thousands, if not probably millions of human beings through whom I will learn things. I mean, even on my Instagram account, the things that I hear from people and the questions that they ask, I mean, people I don't know that are literally around the world. And I'm like, I don't know. That's a really good question. I'm going to look more into that. So yeah, I'm so blessed beyond belief. It's amazing.
Yeah, that is amazing. And I mean, you were just talking about energy, but I do think that just you obviously have a very strong faith, and you allow that, and you allow your connection to God and your trust in that to guide you. And I think you and your practice and your work and everything that you're doing for your team and the patients around you is an example of just how powerful that is when you do kind of give yourself to that trust to something greater than yourself. And from a clinical standpoint, I would say I do follow your posts on social media, and you do some very complicated things, complicated cases. So clinically, and I mean, you don't necessarily have to go into all of the details of it. I don't know if that would be of interest for a lot of people outside of me.
Yeah.
But how do you navigate that? Because I mean, these really complicated cases where you are systemically looking at patients and trying to, in some cases, almost do a complete reconstruction.
Yeah.
How do you navigate that? How do you plan for it? And then how do you execute that for somebody who has perhaps traveled across the country to see you and is on a schedule?
Yeah, absolutely. Well, it as you know, I mean, it depends person to person, of course. It depends on the complexity of the plan, and it also depends on their willingness to commit to their own health. So, and again, like everything we do is a learning opportunity. It's not the perfection of dentistry, it's the practice. So, they understand. You've probably noticed my tagline, or what we call our brand promise, on everything I write. I remind people at the end, Blodgett Dental Care, human beings helping human beings, because none of us are perfect. That being said, all those years of technological development for my own mindset, skill set, we have implemented things that allow me to do care that is unique in the world. I mean, I'm currently in a bone grafting continuum with all these, it's like 32 amazing dentists from around the world. And we've all got our unique expertise, I would say. So it's awesome that I get to learn from everybody. But what I bring to it is this synergy of human health understanding, knowing to whom I need to refer before we do what I want to do, so that their terrain is healthy enough, right? Their body is ready to go through this. Once I get green lighted by the health team, then I know it's okay for me to step forward into the dental side. But like right now, I have one woman whose story I cannot wait to share. She was told, you need full upper and lower denture. And she's like, 2 years older than me, so I can appreciate that. The idea of taking every tooth out of your head and putting dentures in sounds horrible. And I said, well, again, I started doing regenerative periodontics back in 2004, got a lot of arrows in the back from the periodontal community for a decade. And now they all do it, of course, because it works. So, I look through the lens of what can I keep and predictably help you regenerate? And what is beyond saving? And then if the teeth are going, how do I help you accomplish having a whole smile? What does it mean, by the way, if we take out a bunch of teeth and put in ceramic implants to your body's energy?
Right.
It's like putting ceramics in meridians does have an impact. So we want to think about that as well. So every single one of them is an art project. Truly, it's a human, biologically based art project. The mother-daughter who I saw on Wednesday, the mother's plan, I think I went through 3 revisions on that as I thought about it for 2 months, So the beauty is, by the time I actually went to surgery on Wednesday, I had digitized everything. I already knew where her smile was going to be. At that point, I've done the surgery in my head 5 times. It's a matter of execution. And I have my entire team, assistants, hygienists, anesthesiologist, everybody's there to support it. We have, post-care support people. It's an awesome system. And it's still, every day I learn, truly how could I have done this better, which is part of the beauty of sharing the cases. And I hate using the word case because I don't want to think of as a human being as a case, but I mean, when we're looking through the lens of objectivity and how do we plan certain things technologically and that, it's awesome. Like, truly, I'm trying to share, like yesterday I was doing it was a gentleman's left central and left lateral incisor. I'm creating it, doing all the lab work because he flew in from Nicaragua so that he can go home the next day with a perfect smile. And the skill set that I have to do that is taken 25 years to build. I didn't come out of the gates knowing how to do that. But I also create the time and the schedule where if it takes 3 hours, I'll see other people while things are firing in the oven and, that sort of thing. Like, there's some artistry to the scheduling, of course, but
sure.
His chair is open until we're done, whatever that looks like. And we also go into relationships on those new patient experience visits where, we try to share that we're not perfect. We're going to do whatever it takes to make it until you're happy, whatever that means. Sometimes that means revising care. And I was just talking with a woman yesterday where we had put 2 implants in her 2 front teeth. For her, it was the right central and lateral. Woman with a beautiful big smile. And the central implant's doing great. The lateral implant isn't. And I'm like, ideally, like, if you're my sister, this is what we do. We go back, we revise, and it's going to take more time, but, she's roughly my age. I'm like, you may have 50 years of life to live still. Let's do it right. And she's like, absolutely. That's what I want. I want the healthiest outcome that looks the best. And if that takes more time, it takes more time. So us not expecting perfection from ourselves, the patient having grace with us, that we're doing our best. That's kind of the ethos of our space. I hope that answered your question.
Yeah, it definitely did. And I think it just highlighted, I believe, I haven't seen you in your practice interacting with patients, but just from what you're saying and the care that you produce for people, I think you do have a really strong hold on your ability to communicate well. And I think really that's what amazing patient care comes down to, is communication. And in dentistry and in medicine in general, I think there's this, it's a little bit of a dying concept now, but this like God complex mentality almost, where as a clinician, you're always right and you always know everything and everybody should always be listening to you. And the approach, which is, a much more humble and human one, to say, I'm not perfect, I don't know everything, and I can take what I do know and do the best that we can do for you. As I said, I've been following you on social media for some time now, so I know that you're also involved with and interested in the energetic aspects of human healing. And so could you go into a little bit about that? Like, how do you use, as you just mentioned, the meridian system when it comes to planning something for patients? And how do you even explain that to patients? Or do most people who come to see you, are they already aware of and have some sense of why that's important?
Yeah. Oh, I love that you're bringing this up. Literally last weekend, I was with my acupuncture meridian assessment team member. She is like, God made her to do that. She is so good at it.
That's awesome.
Yeah. So I first learned of muscle testing through patients. I remember when I first heard of it, I'm human. I was like, what?
Yeah.
What are you talking about? I remember like patients bringing in, it was like some sort of copper plate, and they're like, I'm going to reverse the polarity. And I'm like, what? But it was I generally am just energetically open to ideas. So, I remember 2018, I heard about this muscle testing class up in Seattle through Dr. Dietrich Klinghardt, who was involved in Bastyr University. He's now involved in Swiss Biohealth over in Switzerland. And I thought, hey, patients have been asking about this. Let's go learn about it. So I took all 4 of my hygienists and my dental associate up there, and we learned, and it was amazing. The practice of it for me, like I didn't have the knack. Let's put it that way. It wasn't my skill set, but I really appreciated the learning. So a year later, I'm reading a book called Accidental Blow Up in Medicine, written by Dr. Simon Yu. And it was so funny as I'm reading it, he's mentioning how he and his wife live in St. Louis. And I was like, I'm going to be in St. Louis next month. So I was in Hawaii at the time on my anniversary. I call up Dr. Yu's office and I say, hi, my name's Kelly Blodgett. I'm a dentist. You don't know me, but I'm going to be in town. Would it be okay if I came by to introduce myself? I'd love to meet you. And they just open doors. Absolutely. Come on in on Friday. And I met him now 6 years ago. Fast forward, I've been to his office. I've watched him just one-on-one. When I'm in town, I'll just go watch him work with patients. I took team members to his trainings. We have since implemented acupuncture meridian assessment. So what that is using a measuring device where the patient holds in one hand a little brass rod that has a cord that goes to the machine. There's another cord that comes off where you touch the dental points, which then with the other hand with the brass rod, they can touch teeth and such and include that in the dental meridian. And so we're able to, like yesterday, I was taking out a lower left second molar for a woman and cleaning out the jawbone behind that, where she had a cavitation lesion where her wisdom teeth had been removed. And we measured the energy flow before I did anything. So she's already anesthetized. Let's go in there, let's stimulate the meridian and test the energy flow. And we see it's way out of balance. For her, it was very high, indicating there's some type of inflammatory upregulation of energy. So after I take the tooth out and clean out the bone, I then have my practitioner come back in and remeasure. And it wasn't balanced. So then we keep cleaning until energy balances. And this all started when I was on a podcast 5 years ago with Dawn Ewing. She's the president of the International Academy of Biological Dentistry and Medicine. And we're talking about how to help bone heal, blah, blah, blah. And she says to me, she's like, so Kelly, how do you know when you've cleaned enough? And I was like, good question. I don't know. And so after the call, we had a post-game session, and she shared with me how they were using EAV in her career. And I bought one the next day. I actually bought 2. I tend to buy 2 of everything. So, if something breaks down, you're not like, oh, well, can't do it.
Yeah.
So we have a very fancy one and we have a very bare bones one, but they both work really well. So it's been about 5 years in the integration process of how we integrate energy meridian assessment to verify that the energy on the meridians we're working balances, so that the body's saying, cool, energy's flowing well again. Now you can graft, or you can go on to the next step. And that's what Kaylee and I were doing last weekend, was teaching the dental side of how we're using this in our practice day to day. And I was so encouraged. I mean, I've been to his meetings. This was the 5th time I've been. You know, there might be 1 or 2 dentists who come. And this year we had 6 dentists there. And I was like, that's really cool that dentists who are wanting to move in the biological, and I do mean move, because you have to shift. You have to get to that space, and it's a continual development process. But I absolutely love it. One of the biggest challenges we've faced in the last 2 years is Kaylee had 2 children. And I'm like, man, what are we doing without Kaylee? And there are other ways. I mean, I find in my own 2 hands, I'm not a very good EAV practitioner either. She is. But using a pendulum for me works much better in my own hands. So sometimes I'll do that. But, on our website, we have an interactive chart. In our new patient rooms, we have 2 rooms specifically designed where the space has nothing to do with dentistry. It's all over in what we call our wellness wing, where we have like our full body red light, infrared light thing. We have we do IVs there. We have a PEMF system, pulsed electromagnetic frequency system. And the whole chart is huge. It's right there in front of people so they can read it for themselves and see, oh, that's so crazy. The 2 teeth that are dead and infected are on the meridian of my ovaries and uterus, and I've had 5 miscarriages in the last 3 years. And I've seen these people then have like 2 and 3 children. And I'm like, we cannot ignore it. I mean, I guess you can. That's just doesn't work very well.
Yeah. Yeah. And so when you're working with patients, what types of procedures, or is it all types of procedures? Because I mean, we're at any given time putting things in, taking things out.
Yeah.
And no matter what you're using, those things do have an influence on, your biofield overall.
Yeah.
So do you use your acupuncture meridian assessment or some variation of that for pretty much everything? Or are you selective about the types of procedures you use it for?
Good question. Once in a blue moon, we'll use it for biocompatibility testing. But more often than not, I prefer for materials, I tend to use Biocomp out of Colorado. It's a blood test where we send it to the lab. They send us a 250-page report that is inclusive of every dental product on the market, practically speaking. Not every product, but almost every product. So it's helpful for me to see, before I'm restoring teeth, what bonding agent, what composite, what ceramic, what implant, blah, blah, blah.
Yeah.
So that just gives me a very good roadmap from a material standpoint. Now, I've also observed that certain materials so far, after doing hundreds of these tests, certain materials tend to work for everybody, so far as I can tell. But I can't make that assumption, of course, which is why we still test. But there are also materials that are commonly used in almost all dental practices, like Emax, for instance. Emax, I've never seen anybody be compatible with it due to from what I understand from the bioscientists, it's the lithium in the material that presents risk. And I'm like, wow, I did a lot of Emax back in the early 2000s when it first came out, Now, just because it reads as, how do they say it? Highly reactive. That's how it comes back. Highly reactive. Because something's highly reactive doesn't mean it's going to tank somebody's health if it's minimal risk, meaning it's a glazed fired crown. Maybe it won't impact. I don't know. That's where EAV or AMA, acupuncture meridian assessment, that's where that comes in to test, well, how's the energy now that we're done?
Right.
And I get it is a departure. I mean, it is a new skill set. Even finding Nirvani, even finding the team members who are most likely to do well with that technology. I have found that there are some of us, people like me, who are kind of up in the head space a lot of the time, like I'm trying to solve the puzzle. When you're using that technology, you don't want to be there. You just want to be what is, and just do it. And I have 2 team members that are that way. Just, yes is yes, no is a no. Tell me what to do, I'll do it. And not to say that they're not thinkers by any means, but they have that ability to just be present and engage in what is happening right now without thinking about anything else. And so as we were coaching these dentists last weekend, I was describing, like, number one, get a team member trained, because you have to do the dentistry. So they're like, oh yeah, that makes sense. So choose somebody whose yes is yes and no is no. They're not going to overcomplicate it. And it's really cool to see people engage in that, because it works.
Mm-hmm. Yeah. And it is, I mean, for the team members responsible for it, as well as for patients perhaps, but within the realm of what your role is in an office, in a dental office, like that, as you said, it is a departure, but it's also just a new avenue for what's possible through dentistry, and, acknowledging the energetic, or the, for lack of a better way to describe it, the more metaphysical parts of our reality that do still influence, how you heal biologically.
Well, I think what's interesting is, if you and I, God forbid, got injured and went to the, emergency room, and let's say we're concerned about a heart rhythm, the first thing they're going to do is put leads on you that read your energy. I mean, because I've had a lot of dentists say, that's hooey, that's crazy, you're measuring energy. And I'm like, don't you get EKGs? Like, this is simple energetics that is our daily norm when it looks like this. But, when it looks like we're measuring a different body part that we're not accustomed to seeing, it's easy to poo-poo that. But I think it's wise to just open up our mind to what's possible. We already measure energy in healthcare. What if we applied it to dentistry, and how could that help,
Right. Yeah. And that, like, very true. That's definitely a framework that I think gets missed. These are the acceptable ways to use the idea that, we're electromagnetic beings in every sense of that term, EEGs, ECGs, these things are accepted use cases for the idea that we're energetic. But, if you bring up EAV, that seems a little bit more woo-woo or out of the box. But I think just to normalize it within dentistry, you're one of the people, and especially with now you going out and helping other dentists make this possible, you're one of the people who is, in my opinion, you're bringing some normality to that within the industry, which is really cool.
Well, thank you. I think it is probably part of my appeal is I'm a pretty regular guy. Like, I mean,
well, you're doing pretty extraordinary things.
Well, so thank you. That's God working through me for sure.
Yeah, and you're allowing that, which is, as I've said, that's amazing. I do have one more question for you here, Kelly.
Please.
I would love to hear, with all of your experience and with the way that you have structured your practice and what you're doing right now, what are you most excited for within the realm of dentistry, and how we can shift how we look at dental health, both as patients and as practitioners?
Yes. Well, for one, I want to acknowledge all those dentists who have participated in trying to create more awareness about the whole body approach to dentistry. Mark Breiner certainly being one, Ulrich Vols of Swiss Biohealth, Dominik Nischwitz out of Germany, and what he's doing with creating a biodentistry community. What I'm excited to see is that it's no longer like this one dentist here who kind of saw the light. They went to Eastern Medicine Conference, and now they're very quietly doing this and don't tell anybody else. I think the human race is becoming aware that, many already knew that, dental health's connected to everything else. We just, as a practice, haven't respected that or acknowledged it.
Yeah.
So I'm so excited to see that there are some objective standards being set for what it means to practice in a biological realm. Certainly to appreciate that it is a progression as we're going. But I think that there are some standards being set by which dentists can then say, yes, I am practicing holistic and or biological dentistry, or whatever else you want to call it, right? Functional, integrative. There's too many words. So I think it's really cool that through the IAOMT, the IABDM, Dominic Nischwitz's group, that some standards are being set because, I've been doing dentistry so long, I've seen the catchphrases come and go, from cosmetic dentistry to minimally invasive dentistry to, what was the stuff? Neuromuscular dentistry. Like, these words have any meaning about anything. Like, let's pray that every dentist is thinking about the neurology and the musculature when you're doing dentistry. You make one high crown, you're going to ruin somebody's life potentially. So the adjectives used to describe what kind of care you're providing up until recently has had minimal meaning, in my opinion. This is Kelly's opinion. So I'm so excited to meet people now, like at this meeting I was at last weekend in St. Louis. I got to meet these two brothers from LA that they have built a glorious practice down there. They're really pursuing the whole biological realm. They're doing the work of integrating new concepts. I'm so inspired to see that, because truly I've been pinged from people around the world. What I know for sure is every year I can see approximately 300 new patients. That's the math. Given the number of new patient slots I have and how many Mondays I work, that's it. So, getting pinged by tens of thousands a year, it's helpful when I can refer and say, hey, you're in Sheboygan, Michigan, let's say, like, I just met this great doctor, so-and-so, like, and I know that they have studied to this level and have passed their tests and whatever, they become certified to do these. I just think that is so exciting, because in my experience, and certainly Dr. Simon Yu was echoing this last weekend in his lectures, he kept saying, here's this patient with cancer, blah, 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 dental, dental, dental.
Yeah.
And we're like, okay, here's a person, who lost the function of their right arm, dental. We're like, huh. So we're finally starting to see that, yes, what we do, and you're so right, Nirvani, everything we touch and change alters the energetics of that individual. Appreciating that is the start to really being able to not just drill and fill, but to actually change lives. So it's a pretty exciting time for you and me to be in this, working in this capacity of something that's so integral to people's wellness.
Yeah, and you just mentioned Dr. Simon Yu, and I read his book as well. Initially, I had read it about 5 or 6 years ago, Accidental Blow Up in Medicine.
Yeah.
And I was on a trip recently and I reread it on the plane. And one of the things I came away from is I was just reminded that every single case study that he put in that book, the first thing he does, amongst some testing, but the first treatment that he would suggest to patients is cleaning up their dental health.
Yeah.
Which is, that just speaks to the importance of, your dental health in relation to what's going on to in the rest of your body. And you said this earlier, but as a profession, we know that dental health is linked to, I think now we're up to 57 chronic diseases. It was a recent study that was published, but aside from by and large telling patients to brush and floss and minimize sugar, like these very conventional, long-standing stories that we all heard in dental school and for the most part, we kind of run with, we're now getting glimpses into the practices of other people who are saying, there is this whole health picture to people that starts and can really be either amplified or depressed depending on what's going on in your mouth. So I just think that we're in an exciting time because we're acknowledging that. And I think it's, like you said, not just these silos of people practicing quietly. We're, as an industry, as a profession, we're acknowledging that this is a very real thing that we all kind of need to get the proper education on so that, we can, if you're a provider, you can help people. And if you're a patient, you can seek a provider that's aligned with, your take on health.
Yes. I feel like my unique twist or perspective, maybe that's a better word. My unique perspective is I want to help dental teams. I mean, truly the teams, because it cannot happen if the team's not on board. See the value of slowing down to really listen so that the person can, like, once you've established real trust and you understand this is that person's goal, then our job's pretty easy. Like we know how to solve problems. We might want to expand our list of how we do that, but we've got generally solutions. What we were trained to do is have this dogmatic approach. Oh, here's a tooth with a mercury filling. I see some cracks in the enamel. It needs a crown. It's like, well, does it really? I mean, have you taken the tooth apart yet to verify that everything's so fractured that you have no other options? I mean, why do we have bondable materials if we're just going to crown everything, And if the person says, I want to have my best state of health my entire life and I want my oral health to align with that, then we have to think like tooth physicians, My analogy for crowns, by the way, is like if you tore your ACL and, which happens to thousands of people a year, and the orthopedist told you, well, okay, we're going to do a total knee replacement. You'd look at him like, what are you talking about? I just tore my ACL and maybe injured my meniscus, but wouldn't you just fix that? No, total knee replacement. You would say that is crazy. But we've created a dental experience for human beings through which they rarely have the opportunity to see what we see. So, again, touching on the technology, every step of everything I do, I either photograph it or I videotape it because I want I want there to be validation that what we did had a purpose and a reason. But more importantly, I want them to be able to look at it and go, that makes perfect sense. I totally understand why you did that. Then it's like, now it's all open communication. We're all on the same page, so.
Yeah.
Still
and it just makes it.
Oh, good.
It makes it understandable for your patient, which that's the biggest thing. You have somebody in your chair who's trusting you, who's probably there for hours at a time, having these things done, and that's a really intimate way to interact with somebody, and so you want them on board with what you're doing and understanding what you're doing.
For sure.
Yeah. So Kelly, I just want to, first of all, thank you for your time today.
Thank you.
Thank you for this conversation. This was awesome. I mean, I could talk to you for hours, truly. I have a lot of technical questions that I won't ask here that I would love to ask. But is there a place that listeners can find you or places that you want to drop here?
Yes, please. Well, for anybody wanting to see what Blodgett Dental Care is about, certainly they can go to my website, which is blodgettdentalcare.com. I would also encourage them to go to my Instagram page, which is at Blodgett Dental Care. For any healthcare providers, dentists, or what have you, they can go to my new coaching page that I've recently built, which is Dr. Kelly J. Blodgett. So Dr. Kelly J. Blodgett, no periods, .com. And they can hear from other dentists who I've coached and helped mentor, who are building the practices of their dreams. which is super exciting. And then please, everybody, be aware that this September, my book, Feel Whole Again, will be coming out. And I'm thrilled to offer it. The intention of the book is to help people appreciate the value of subjective information that people share when they're in healthcare settings. It's built mostly for human beings who are going to seek healthcare, which is all of us. And if somebody's not creating space for you to share how you feel, to ask for it. So looking at what does it mean when somebody says they're frustrated or they feel hopeless or they feel inspired? Every word that the patient uses has meaning. I train my team that when somebody says, Claire, I feel like, Claire's one of my team members, I feel like, you write down everything that they tell you, because that energy they're sharing is like it's the secret weapon to understanding what's going on for that human being. And that's why God had me go through a program of getting a psychology degree to then become a dentist, is to appreciate that what people share matters and it has value.
Right.
So excited for people to read the book. Hopefully people love it.
Well, I'm excited for it to come out. So September.
I'll get you a copy.
Well, thank you very much.
Absolutely.
Thank you, Kelly. I know you have a day ahead of you that you probably want to get on with, but it was great having you here, and it was great having this conversation with you.
Absolutely. I can't wait to meet you in person someday. We got to find a meeting and connect.
Yeah. Well, I'll have to let you know when I'm down there. I don't know if you're coming up to Winnipeg anytime soon, but
not immediately, but maybe, you never know. It depends on if there's a practice that wants some coaching.
If there's a practice. Yeah, very, very true. Very true.